Good morning. Good afternoon, everyone, and welcome to our Children, Seniors, and Families Committee meeting. And what we're going to do is we're going to start with Ignacio. We're going to introduce ourselves. Supervisor Cortese will be here at 2:15, so we're going to begin.
Thank you. Ignacio Guerrero, Director for the Department of Child Support Services.
Good afternoon. Bob Minicucci, Director, Social Services Agency.
Rob Coelho from County Counsel's Office.
John Mills from the County Executive's Office.
And Cindy Chavez, member of the Board of Supervisors. So what we're going to do is we're going to take public comment first, and I've only one speaker under public comment, and then we're going to skip number 3 because I need Dave to do that. I think what we're going to do is take things a little out of order and start with the probably with the contract and procurement, and then we'll go down the rest of the agenda as laid out. And I'm mostly doing that just because I think I'm gauging a little bit of what I think Dave's most interested in and things we need to take action and give direction on. So we'll begin with public comment, and and that is Scott Largent. Welcome.
Hi, good afternoon, everyone. Scott Largent. Good afternoon, Cindy Chavez. How are you today? All right. I normally don't jot things down, so I was writing this thing in the back. I have moved up in public comment to, it's the Judicial Council of California. So I was able to go up there about 3 weeks ago and crash their party and do my public comment. Of course, a room full of judges that I've been criticizing for about the last 2 years didn't want me there, but if you have an opportunity to go on YouTube and type in my name, that's where I'm putting all these videos up now. I just think it's appropriate to do. I put all the chest cameras from my malicious prosecution with the bullhorn. When I talk about this stuff so much, I want people to see what I've been going through. I think it's very important. What I'm going through now, I do get to see my daughter. Sometimes it's twice a week. Sometimes it's once. It's kind of hit or miss. But it's been consistent now. So I'm able to have that bonding time with my daughter. She's 3 years old, and it's a lot of fun. So I'm having a lot of fun, even though we're confined into a room with a visitation provider. We really are like peas and carrots. We're having a lot of fun. We can't go out on the lawn anymore or the fountain outside. We were throwing pennies in there and splashing water and doing all these things I did when I was a kid, and I guess you can't do that at these places. So what I want to talk about today is what family court is doing to me now over there. What they like to do, it's divide and rule. We talk a lot about how we're separating families at the border. We're doing that at our family courts right here in Santa Clara County. I call it the Family Destruction Center. And if I still owned my electronics business and I was still making good money, I could only imagine what I would be throwing into that scam over there with experts, attorneys, and I kind of estimated it and looked over everything, what would happen. Mediators are unqualified, so when you take my ex and myself and stick us in a mediation process, nothing's getting done out of that. So, I guess what I'm trying to get at is because I'm not wealthy anymore and because I'm coming out of poverty, drug addiction, and trying to get services to the county, I can't get a proper legal defense in family court, and it's just not panning out. I've done everything right, and they're just going to continue to divide us. We need skills on how to co-parent. My ex has no criminal record. I now have no criminal record. They need to stick us in a room and say, hey, look, you have a 3-year-old. You need to figure this out. You need to co-parent. Instead, they really are trying to keep us apart. And I'm not saying that I want to run and get back together with my ex. She hasn't talked to me in a year and a half. But we should be working on those skills. And then also there's no punishment for her not cooperating. Now, I blame the system and not her. She's committed contempt now over 100 different times for me seeing my child. DA's office won't prosecute because you know why? They want you to file more motions in court, spend more money on attorneys and experts, and feed that scam right there. And I just think that's sad. So thank you.
So thank you very much for that input. We're going to move then to item 7, and this is our contract and procurement operations. And if I think we have, let me just look to see who's presenting. George, are you going to present today? Mr. Montes?
Yeah, good afternoon. Yes,
Great.
I'll be doing the presentation. So I'm waiting for the slide to come up real quick. Good afternoon. My name is George Montes from the Office of Contracts Management for the Social Services Agency, presenting on the FY 18-19 summary of the contracts overview for the Social Services Agency. We got a brief PowerPoint presentation to go over really quick. First, this report is at the request of Supervisor Chavez. It is reported annually. More frequently, it is now presented twice a year. The intent behind the report is to inform the CSFC, the community, and also people that participate at the CSFC meeting on the activities relevant to updates related to OCM's, the Office of Contracts Management strategic goals. This report was created on July 2nd, right after our renewal season for the contract process for the county. July is the start of the fiscal year. On July 2nd, we had an active list of 354 contracts totaling $135 million. 456 in dollar value, but not all contracts are paid by County General Fund. We have a mix of funding streams that make up the contracts, and some of these contracts are also in different types of years, like federal fiscal year or calendar years. And just notable achievements. I went over the FY19 contract overview. Over the course of FY 17-18, the staff participated in a lot of procurement best practice standards, including procurement market research. Future trainings that have now been incorporated are also negotiation and financial analysis. And just to bring perspective on how those are applied, when we receive RFPs, these financial analysis types of methodologies are incorporated in the review of what is an organization that is sound or has good financial practices and whatnot. That helps us determine those types of decisions. We also, through the Office of Contracts Management, have made a lot of effort in centralizing processes, so we have improved internal controls, more management of information coming in, so we could collect information with integrity, and so we could report outcomes and processes for decision making. One of the more important strategic initiatives was the initiation of performance measures. We started this initiative 3 years ago and are gaining ground as we develop our process. What our strategy is in adopting performance measures for all our contract portfolio is every RFP that is now issued will incorporate expectations on performance measurement in both administrative outputs and outcomes. And we provided some samples of some of our dashboards that we've incorporated. Also, we are moving, I believe, 6 additional networks into the FY19 fiscal year to incorporate performance measurement. What we do with those types of reports is we share them with the vendors. We also incorporate them into our decision making, and we kind of like apply a CQI process for those types of kind of like information to kind of like more, make decisions more relevant to evidence. We've also have been pretty influential in helping move the county into best practices through our collaboration with the Office of Countywide Contracting, Procurement, and through the process of policy development and procedure development and whatnot. So these are some of the notable achievements that we've accomplished over the last year. Our next steps for the office is to continue to empower our staff, the vendors, to learn, adopt, and practice procurement best practices. Something that we are experiencing more and more is the workload that's associated to all of these new initiatives. Data management, data reporting requires efficient practices that should be supported by technology. Certainly, we are exploring technology to promote more transparency, visibility, and to have a more efficient way of reporting performance measures. In the FY 18-19 fiscal year, we have 6 new networks of providers that will adopt performance measures that are standardized to the practices. The reasoning behind that is we want to have interreliability between how people or vendors report information, so we could do systemic comparison on common like data elements. And we want to initiate a CQI process that is inclusive of the voice of the vendors, the customers, our infrastructure, to develop greater intelligence on how we want to use this information or better define the information that we are exploring. Ultimately, we want to serve, empower, and transform. And this is my presentation, so I'm open to any questions you may have.
Great, thank you. So first of all, I just wanted to say to you and your team, thank you for the really hard work. And I know you're turning a ship, and this is, I don't think there's, I think there are very few internal work that we do that really can impact service delivery as much as procurement can. And so thank you for that. And also just wanted to thank the staff. I asked for some additional information and got rather a really good additional report that I thought was really productive and helpful. So just to take a step back, I'd like to get your thoughts on how using something analogous to quality assurance programming, how we drive that to help us look at not just inputs, but outcomes, like those things that we intend to measure that help us understand the work that we're doing at a much, frankly, at a much deeper level than I think we do countywide today.
Yeah, absolutely. That's a great question. And through the process of CQI, the outcomes has a broad kind of like description depending on who you talk to. So there's further analysis on involving different stakeholders on what that really is and how it is, how does it align with that specific contract. But just to showcase some of our dashboards, what we attempted to do is both collect the outputs and separate what is an output and to an outcome. So we started with that discussion. Service delivery, count of people is not typically an outcome. It is just the population that you serve. An outcome would be a measurement of something of effectiveness. And what we've attempted to do is focus like the service delivery scope into what is it going to be that's going to tell us that we've actually achieved something. Schooling services is very different like to safety net services. And a wraparound is very different to like schooling services because they all have their own specific like scope and measurement. So just to go back to the how we've attempted to align the scope to the outcomes, like so in schooling services, it is really intended to measure the effectiveness of reaching academic goals, to keeping people kids in school, out of trouble, and we've included measurement of that through the surveys, a quarterly report that we receive from every vendor. So at the end of every quarter, we look to see what these vendors are saying they've accomplished. We go back and audit information against that, and then we have a discussion. Hey, this is what we see. This is an area of low performance. This is an area of great achievement. How are you reading the information? And through that process, we kind of like get to a point of really defining what is going to be the measurement of effectiveness.
So on that front, two things that I want to make sure I just raise with you that I've talked to the administration about, and actually I've had some really great conversations, both with the county executive staff, but also with Bob, and that is that I am very interested as concurrent to us letting out our first expanded contracts on a number of these areas, that we're also making sure that we have taken a piece of the pie to actually put to vendors that can help us put some outside eyes on whether or not the practices are evidence-based. And the reason I'm particularly interested in that is that I think when we acquire good, thoughtful ideas from other parts of the country, that's actually great. And I'm all for us using someone else's evidence-based practice because that means they spent the time and the resources to learn what works and doesn't work. But I think when we're applying new thinking or even what we consider to be evidence-based practices into our community, it's hard to assess whether or not our interpretation of that is in fact the evidence-based practice that was core, number one. And I think number two, I think that the catch-all phrase of evidence-based practice has become analogous with that do good stuff that someone else did first. And I'm not sure we've really refined it enough to say, under these terms and conditions, it makes sense for us to continue this type of investment. And the reason I think having that third-party partner is important is, I think if we start to do contracts over a longer period of time, an example would be that we sit down with the DV providers, we're infusing a whole lot of new money in that. We want to sit down with them and say, let's take a look at let's try something we haven't tried here before. It's a 3-year contract. 1 year in, we're both looking at the results and we say, wow, this isn't working. Let's shift it up. I think having that external partner that, for lack of a better word, I don't mean it's just necessarily a referee, but someone whose research will help us understand whether or not we really are moving the dial on domestic violence. That's really the kind of thing I think we've embedded that. We've tried to be directive with that with certain pots of money, but we haven't really done that across the board.
And I would just add to that, with the federal changes coming through the Family First Act, all the programming that will take place under that is mandated to be evidence-based, and the work that's going to need to happen is deciding how that works, what the regulations will be, and that will help all of us, I think, establish a framework of exactly how to do this kind of business, where some standards are laid in place around this work.
Well, and I think, I don't know, Bob, if it was you but I thought it might have been that someone I was having a conversation with around under what terms and conditions do we determine something to be, in fact, evidence-based? And I think in some respects, what I'm hoping, given the amount of resources we're putting into, our cross-services training and all of that, is that we actually are starting to produce our own findings. This is an example that doesn't impact this discussion directly, but as we're looking, for example, at reentry, one of the benchmarks we're using for reentry is whether or not someone recommits an offense within a specified period of time. And I think that's actually an incredibly important benchmark. Are we making the community safer, period? I think at some point what we're going to have to be looking at is also harm reduction. So if the person was getting arrested for X kind of activity and now it's Y kind of activity, are we moving them down the self-harm, harming other people, and can we quantify that? Can we quantify the investment we're making in that person, that we're making their behaviors less dangerous, even if it isn't zero? And I think in domestic violence work, that's another really good example where our benchmark has been, does the victim leave the abuser? And then we had success. And I'm not sure I don't know that is success for every family. And so as crazy as that may sound to some, that, we really are overlaying a success model that I'm not sure is achievable. And I think the same thing, we think about this with education. Did the kid go to Harvard? Well, if you're in foster care, and I just talked to a foster youth from our community that is going to Harvard, by the way, which is probably why that's fresh in my mind. But there are a bunch of other young people who are going to De Anza or going to City College, and where do we equate that? So in any case, I guess what I'm accepting, which I never did before, is that there's a gray even to outcomes, that I want to make sure we've developed a system that is sophisticated enough to be inclusive of the information we're getting, so we start to understand more about how our investments really are impacting the lives of others. And so that's partly why I'm pressing on this question, which I recognize is not an easy yes or no, oh, this is what we're going to do answer. That's just the goal. That sound realistic, or?
Oh, absolutely. I think it's a great vision to have. Certainly, I think that's where we want to end once we get to a point of process. And I think during the onset of any type of data exchange, definition of outcomes, we always start with just a framework and a lot of questions. Once those questions surface, we incorporate the voice of the vendor. They certainly have a lot of experience in this, to see if we could better define what is going to be the actual measurement. Certainly, that's what we've experienced as we deployed this project 2 years ago, where the initial deployment was a little bumpy, but 2 years later, we're at a better place. I envision that in 2 years more, we're just going to improve and improve as we kind of like massage this information and get it to the point where you see it.
Did you want to add anything to that?
I think I'm set.
So I have a longer question that I'm not going to ask you to try to answer this today, but it is something that I want to see as RFPs go out. And Rob, you know, I'm not sure, I'm going to look to you because I'm not sure exactly how to make this happen. So all year long, the board makes policy decisions. And some of them, I know the staff looks at and goes, okay, yeah, we're ready for that. And others, you're saying, what are you even asking us to do? And so it occurs to me that sometimes what I think policy decisions are that have been made at the board are not fully implemented by the organization. And sometimes it's us not being clear. I think sometimes it's the communication that gets to staff about what the it is. So I want to give you 3 examples. And I want to ask the staff to figure out, as we are voting, taking final action on these items, a way to elucidate or highlight those initiatives that are new to the contract based on changes in policy. I want to give you an example. A few years ago, I had asked that the Behavioral Health Department, and the board said yes, adopt a good neighbor policy. And what that policy was supposed to do is that if you were getting funding from the county and you had a group home in a neighborhood or you had a facility in a community, that there was a mechanism for a 24-hour hotline that someone could get a hold of someone. So if there was a problem with the facility, there was someone to call. That the neighbors, that the facilities be kept up the same way the neighbors were, that they didn't stand out, and that if there were problems, there was a way to report that so that we weren't continually investing in bad operators in neighborhoods, given that, honestly, one of the calls we got was one of our inspectors inspecting a facility we were funding because of complaints from the neighborhood. And I thought that was both embarrassing and appalling. And we should not do that anymore. Now, I don't know. Everybody said, yay, we voted on it. I don't think it's part of our contracts yet. And I mentioned that because I got a complaint recently, and I said, pull out that good neighbor policy because we should be able to go have a conversation with that provider that they will not be providing in the future. Again, not in your area, but there are a number of areas. And so I'll just give you, like I said, 3 examples. One, we have a language policy in the county. And that language policy includes how we want to provide services and how many languages we want to be able to provide them in. Supervisor Cortese brought a referral to the board for cultural brokers because some of our nonprofits did not have the language capacity and or the staffing to communicate with the people they were serving. Now, I was a little surprised at that because I thought if somebody got our funding that we were expecting them to have those capacities. Now, something could have happened, you know, like a new influx of immigrants came from a new place, although not under Trump apparently, but that you have some new condition that then therefore we're responding to. But from a basic perspective, our language policy should be carried out and interpreted through all of our contracts, and in some cases where we have an agency that may not have capacity because they're changing, that may be a reason absolutely to add cultural brokers or more resources. But to me, across the board, to create a new program didn't really make sense if our expectation was services were already being provided in a culturally appropriate way. So that's one example. Another example is something that we'll be bringing to the board. So our Foster Youth Task Force will have a special hearing of our Children's Family Services Committee if Supervisor Cortese says that's okay. Not to put you on the spot, Dave, but I thought you would, so I already said yes. But one of the expectations in that is that if we have partners that we are resourcing with county money, that we want school districts to sign on to using the Data Vision and Data Zone, because it doesn't really make sense for us to keep investing in something we can't track. And so once the board makes that decision, then how does that really get embedded in contracts? And then the other is that, well, like our living wage policy. Those are all examples of things we've already adopted that really should be highlighted in a way that's easy to see versus it feeling like some departments are a little more on it and some aren't. And because I feel like you're a little bit ahead of most of the departments in terms of how you manage contracts, I really would like your feedback on the very best mechanism to make sure we're including policy changes and or policy changes that the staff, procedural changes that you all are working on that may be new to those contracts, just so we understand what changes are being incorporated in them. So again, I don't need a response today, but I would like something as, whether it's off agenda or even as part of one of these discussions, because that mechanism feels to me like it's really important. And we tell the public we're taking this action and we're not really taking that action. I mean, we're declaring it so, but it doesn't mean it's so. Any thoughts about that or questions?
Yeah, absolutely. At least for the Social Services Agency, we always look for opportunities to incorporate new practice, policies, or improvement efforts in our contract processes. The opportunities for us usually lay when we are renewing or amending contracts. That is the best time to kind of like implement those practices. So every year what we do is we kind of like do an analysis against the policies, the directions or recommendations of the Office of Countywide Contracting, the policy changes, and we, to the best of our ability, include all of that. From time to time, we get direction from the board on special circumstances, inventory items. They want a special topic addressed. We do, to the best of our ability, thorough analysis of those requirements and embed those in the contracts. I would like to say that we capture every policy change that is out there, but I'm not 100% confident in that because I don't know what those are all the time. But we do have a pretty good collaboration with other entities in across the county, like the Office of Countywide Contracting, the Office of County Counsel, procurement. And through that sharing of information, we do the best we can to kind of like embed all of these new policy languages into the contract process. From time to time, we do miss language. When we do capture it, we will take the opportunity to kind of like include it through an amendment. But our quality assurance is intended to capture the fallouts of what we might not capture. Certainly, when we do see that, we will kind of like include it when we have the opportunity to do so.
And I think we've recognized, some of the challenges of how things had been structured in the past, and that's some of the conversation we're also having with the county's chief procurement officer of having a more formal process in place so that when the board does something, it isn't up to each department to try to catch it.
Right.
So.
And I think even the thing I really like about that working group is learning how to manage contracts in a new era, right? I really hope that someday we're block granting nonprofits and we really are able to really in a meaningful way collaborate with them about outcomes because their back of house is strong enough, and frankly our back of house is ready to have those more meaningful relationships. I think we'll have much better outcomes for clients, and frankly I think in terms of maintaining sustainability for the county, that if we stay in the intervention business with no end in sight, eventually we're going to run out of resources, which happens to us every time there's a dip in the budget. We start over, and sometimes we toss out the programs that are most effective instead of having an external way to actually analyze what we should keep and what we shouldn't be doing anymore. So that's really where I hope we get. I know that's years from now, but that's what my objective is. So thank you. I'll give some thought to that, because what it may be is something we want to bring to FGOC, and that committee is a great committee to torture these kinds of topics on. So, because Joe doesn't usually mind torturing you all. Just kidding, Joe, if you're listening. All right. So I don't have anything else. Dave, did you have anything on this item? Thank you very much. Thanks for the good work. And thank your staff for all the background information we got. This was really productive and helpful.
Thank you.
On this item? Oh, thank you. David, thank you. Catherine Campbell, welcome.
Thank you. Nice to be here today. Oops, I just lost my page. Let's see if it comes up. Yes. Welcome. Thank you for having us here at the board. And I just want to bring to your attention something that is evidence-based, that is a success. I don't want you to get too excited about the number, because doing this It is estimated that you can save $500 billion, but that's not per county. So that's across the U.S., but it's called the Quincy Solution. It's written up in a book by Barry Goldstein, Stop Domestic Violence and Save $500 billion. This was a process that they did in Quincy, Massachusetts. It is evidence-based, and I suggest everybody here reads that book. Thank you.
Thank you. So we're going to go back up to item 3, and we'll approve the consent calendar. And I already made changes to the agenda, so we're going to approve that backwards. We have a motion and a second? And we'll, thank you. That's unanimous. We're going to go then to item 4, and this is a rake quarterly status report. I know we have a couple staff here to present. So Francesca and David, welcome.
Francesca Ledred, Director of the Department of Family Children Services.
And I'm Steve Fondacaro. I'm the Director of Central Services at Social Services Agency.
Thank you.
Is that PowerPoint going to go up? Oh, thank you. Want to provide you a quarterly update as to the Receiving Assessment and Intake Center. The very first item we wanted to address is the Juvenile Justice Commission report. They conducted their annual inspection of the rake and issued it in July of 2017. There were 4 recommendations. One was to complete the rake policy and procedural manual. That policy and sorry, that's not technical difficulties.
There you go.
Okay, sorry. The policies and procedures have in fact been completed. We submitted the policies and procedures as part of the program statement to community care licensing back in November. It has been reviewed and approved by the department. The pending issue, or rather the reason it has not been finalized and distributed for the public to view as needed or as people choose, is because CCL has not given the final approval and or issued the license. Until community care licensing provides us that license, it is technically still in draft format. To date, we have not received any questions with regard to our program statement, which includes our policies and procedures, and we believe that's very promising. The other was to expedite and make the process to co-locate services at the rake transparent. We have been coordinating with the county's executive office and fleet and facilities to secure a location that will support the needs of the community children, along with integration of the county's master plan and the East Valley plan, and taking into account the proximity to the Spark Clinic with critical support to ease the access of those services. We continue to work with fleets and facility. We have identified a possible
Vacant lot that's co-located with the East Valley Medical Facility. It's a very large piece of county-owned property that we do own and will more than facilitate the requirements for the rake out there in terms of proximity to the services that the Spark Clinic provides, co-located medical services that will be on site, and all those requirements needed for licensure.
And Steve, that's for a temporary location you're still looking at? 'Cause
temporary location against the final project.
The county master plan.
Well in the future, yes, the master plan.
And when you say well in the future, I actually had a conversation with Dr. Smith about this topic, and I didn't ask the kind of critical question, which is East Valley timeline is what?
I can't comment on that particular project.
Because you don't know? Oh, Dave, okay. And Steve, do you work for FAF?
I'm sorry?
You work for FAF or for
I work
Bob?
for Social Services Agency.
Oh, he worked for Bob, okay. All right, Dave.
Good afternoon, Dave Barry, Facilities and Fleet. The long-term plan for RAKE is it integrated into the East Valley Clinic as a larger project, and that is prioritized within the 10-year CIP in years 5 through 7.
And that's to be funded in 5 to 7, or to begin construction, or to move in?
That it appears, so it's FY 22, 23 to FY 24, 25. I believe it's 5 through 7 is year 5. We would start design, and then it would lead into construction.
So just to be clear, start design in 5 years? Yes?
That's what it says in the 10-year CIP currently as our priority.
Okay. And, okay. Now, I am sorry that I don't remember this, because we just started to do these really much more refined plans, and so I don't know, Dave, if you helped with this. But in the 10-year CIP that we just saw in, I guess we would have seen it as part of budget, or right before budget,
Right.
is the East Valley Clinic, is that already got a price tag attached to it, and is that funded? I mean, I know it's not funded because we have to vote on funding, but is there a price tag attached to it, and it's built out into the 10-year CIP with a prioritization the way you just described it?
Yeah, so right now there's a cost figure associated with that build out, and it's, I believe it's 171 million for the total.
Got it.
Now, this isn't just a standalone rake, it's for
I
other
understand. I
facilities.
just was wondering what the total cost was, and my reason for asking that is both, you know, in a very real and meaningful way, trying to understand what the, how realistic is it that it stays in that time frame, and not for any. I'm just more looking at the length of time we're spending on other projects, and again, not to be critical, it's more of an observation because it will help me understand what the implications are of building out in the current at the downtown clinic, and whether or not it makes sense for that to be in fact temporary or permanent at the downtown clinic, mostly because of timing. So that's partly why I was asking. I want to better understand what kinds of options, if I wanted to bring them to the board, to my colleagues, I could. So, okay, I didn't mean to interrupt. Thank you. I'm glad you're here, Dave.
Sure.
But don't go too far.
Yes. The other recommendation was to increase the coordination of services between the Spark, Behavioral Health, and RAKE. Throughout the day, the RAKE staff are in daily communication with both the Spark and Behavioral Health to ensure that the children receive their medical and mental health assessments, including dental, because that's new to the Spark. The RAKE, Behavioral Health, currently provides the KDA assessments, or the mental health screenings, to all of the children, and they provide KidScope to the children 0 to 5. So there's lots of coordination between Behavioral Health and RAKE to ensure that the children are getting the services. I believe that some of the concerns around the increased coordination has been that Behavioral Health is not sitting in the same location as the shelter, or in the shelter. It has posed some challenges. I won't say that there aren't challenges because of that, and we're hoping that this temporary 5-7-year plan will include space for Behavioral Health to be sitting in the same area as the shelter. But it is in fact taking place despite the challenges, including RAKE staff participating in daily huddles with Behavioral Health so that there's discussion and coordination as to the children and their needs. Children are transported to the Spark for their medical and dental appointments. That is taking place. When we move, I'm going to say that, when we move to East Valley Medical location, the drive is going to be even shorter than it is now than Enborg. So again, I think that this recommendation is about the one-stop shop versus the coordination of services. The services are being provided to the children.
I would also add too is the plan is if when we move over to East Valley, we were talking with Paul and Health and Hospitals about making some shifts in terms of having some staff at the East Valley area, so that driving may not even be necessary at all. So those conversations are happening.
Yeah, and I just want to make a point that I think we are moving in a really good direction relative to coordination, but I think, just to be intellectually honest, we're not there yet. I think if we were there, we would see a much higher percentage of children getting their needs met at a much sooner stage. So I only say that not to be critical, but more just to say, I think we've moved a really, far along, and we have more to do, and I think that's where we're at.
Absolutely. 100% of the kids that enter that are actually receiving services at the rake, meaning care, shelter, at the rake, these children, in fact, do get a medical clearance at the Spark. There is no lag time there. There is no issue of coordination with regard to the children who are being served at the rake, care, sleep, meals, etc., be it for 23 hours, 8 hours, or 20 or 72 hours. They are, in fact, receiving their medical clearance at the Spark Clinic and are receiving a mental health screening by behavioral health. So I agree with you. We do have, there's always room for improvement and better coordination and such. And I do believe that there's greater opportunity if we're all under the same roof. But I just wanted to assure you that the children who, for whatever reason, have to spend any length of time at the rake, at the shelter, are in fact receiving
So
medical
we're at 100%?
clearance.
We're at
Yes.
100%.
Medical clearance, yes.
So I'll tell you the reason I was looking at, and I may be conflating two different issues, but I had understood that we actually were having challenges getting, especially older children from the rake, to get to the Spark Clinic to get the medical clearance.
So there has been challenges with the older youth who are 16, 17.
Yes.
Because they'll walk to the corner and so forth. I want to respectfully say that a teenager has their own will.
Yes,
and even
absolutely.
if it's getting on an elevator or crossing a hallway, I think we're still going to experience those challenges. But the kids that have been at the shelter, they have in fact received a medical clearance.
Even if they're 16 or 17,
Yes.
all of them, 100%.
Yes.
So I want to say, I think that's right. I have a teenager. I'm very
Right.
attuned to
Yes.
how well they do or don't listen. Actually, today I had that experience. But the reason I'm asking is I think we all understand that co-location is a best practice, and that we have a better shot if we're not putting a kid in a van than we do if it's an escalator. I mean, I'm more, do you not think that's accurate, or?
I believe there's two schools of thought around that. I met with Amy this week, and I kind of likened it. I just transferred to a provider that has a one-stop shop. I was able to get from the pharmacy to x-rays all under the same roof, but I don't live there. And there's something to be said about the children that have to sleep and eat in the exact same building where maybe they're being poked and prod. I don't know. There's two schools of thoughts. I'm not saying that either one is wrong or right. I just think that...
Well, I actually want your professional opinion about what is right, because I think we have to have a very meaningful discussion about the rake sooner rather than later around what is a best practice and why are we deciding to do it the way we're doing it. And so, for example, if we leave the rake at the current location it's at right now, if we attach it to the Spark, to the
Yes.
Spark Clinic, the reason in my mind for co-locating the building there today, why we're having a discussion about the temporary location isn't just because we have county-owned land, it's because of its proximity to Spark. We have county-owned land all over the county. That's not why we're doing it. We're doing it because it's got proximity to the Spark Clinic and we hope long-term interview rooms and other things that are going to make it easier for us to provide services. You know, so anyway, I am interested in what we think the best practice is, because we shouldn't be forcing a.
Yeah, no, I think we agree. And best practice, you know, there's also the ideal of what the rake is, which is it's not residential at all.
Right.
It's an assessment center. So having the services combined there makes sense. Right now, we have a hybrid that we don't want, which is there is, by default of the evolving system, we do provide some residential care. But in the future, the goal is you come in for your assessment and you're out immediately.
Exactly.
Actually, and that reminds me of something else I just wanted to raise that I forgot to raise under the last item, and that is around family finding. And I see that it looks like we're doing an RFP for family finding external to the county, and I was wondering, want to have a better understanding of whether or not that's something that really should be internal to the county, especially given access to databases that are new and kind of coming online. That is what LA is using. So, I mean, maybe that can get addressed as part of this discussion. All right.
I will
you keep
let
going.
you know a little bit about our family finding. We do have a new system that we're using. It's called Clear. We were using LexisNexis, which we're still using, but are using Clear, which is more faster, dynamic, very deep dive information. And we have a family finding person on staff, and I believe our second one started last week, if I'm correct. So we have 2 people dedicated to family finding within the organization, and we're working on a request for proposal to also work with community partners to help us in that realm. Our family finders are working directly with our children that are at the rake and children that are at group homes and STRTP. That is our first target population, if you will.
And we're having external partners do this also because we think the volume is so big, or?
Well, for example,
will they have access to Clear also?
There is a particular model, family finding model. The name isn't coming to mind right now. But for example, many of the STRTP's program statements include family finding as one of the service components attached to the STRTP. It really needs to start there. So at this point in time, we just feel that because we've had children staying at the rake and we still have children at the group home, that we could augment those types of searches and collaborations with both community and internal staff.
Why don't you go ahead and keep going, and
Okay.
Thank you.
Yes. The 4th recommendation was to provide sight and sound separation between the social work area and the children's living area. Since then, we did provide or place a movable sight and sound screen that was done in April of 2018, and it provides some level of privacy and confidentiality for both the children and the staff. One of the new systems or software applications is Kids App, and it was designed by our social services information systems department to capture the pertinent information in one centralized location in a paperless environment for each child that is admitted into the child welfare system or in out-of-home care. And this includes children who may not have ever entered the shelter for any period of time. The profile includes the child's name, date of birth, admission time, ethnicity, language, education, placement, medical, and mental health information, as well as sibling and parent information. The data for each of the children is captured in real time, indicating how the child how long he's been at the rake and what's happening with the child. The application allows the department to review the data and generate reports to have a better understanding of who we are providing services to. The next steps for the department will be to follow through with the licensure of the rake to a 3-day shelter. We have 2 items that are pending. At this point, we do have a new program manager. Her name is Cheryl Washburn Thomas. She comes with a lot of shelter experience working with our population as well as our families. She's a great asset to our organization, and she has to go through the group home administrator certification process that starts in September. So when she is certified, we're being told by Community Care Licensing that the rake should be licensed. We anticipate that taking place in November because the certification process is about 6 weeks long. At that point, we would then have the ability to finalize our policies and procedures. We will continue to work with our county partners on the relocation of the rake and continue to find private spaces during this short period of time we have left at Emborg so that we can better partner with behavioral health and meeting the needs of the kids. And I have no other, if there are additional questions or.
What I would like to do just on we have a lot of speakers, so I'm going to let all the speakers who want to sit down a lot. So we have James Gibbons Shapiro, Catherine Campbell, and Penelope Blake, who would all like to speak on this item. If you could come forward. I do want to ask for information on the model we're using relative to family finding. And the reason I'm interested in it is that some of the conversations we had with Los Angeles and with Judge Edwards had really led me to believe that the role of the database was actually pretty critical, and the procedures and policies for family finding were critical, and that in some ways it makes sense to have really to have a robust nonprofit partnership to do the team meetings with those families and the support, but actually putting that engine and the investment in the engine that would give us the kind of the research capacity is the one I'm wondering if I want to better understand what we're keeping, what we're splitting out, and why. Thank you. Welcome.
Hello. I'm James Gibbons Shapiro. I chair the ad hoc committee on the rake for the Child Abuse and Prevention Council, and I've been here on this committee before. First of all, I want to say, Supervisor Chavez, I really appreciated your questions and your comments before because I think they are spot on. The question about when the East Valley campus will be built and what's the funding for it, I'll say the $170 million that was quoted is a conservative estimate based on 2017 dollars. So when you hear that it's going to be designed 5 years from now, you should hear also $170 million is not an accurate estimate. The other thing, I would say that it's possibly as much as double that. The other thing I would reiterate that I've said before is that as we're looking to co-location of these services, the fact that the county has already invested so much money and energy and services at the downtown clinic makes that a place that you should be looking at, and I know you are looking at, for location of the rake. If what you decide to do is to locate it either temporarily or for the forever time at the East Valley Clinic, and I know that's part of the long-term plan, that plan must be expedited. It can't happen 5 to 7 years from now. Because what you'll do if you place it there without building all the other services around it is you'll just put the kids at another location where they have to be transported by van to where all the services are. So if you're going to put it at the East Valley Clinic, I recommend that you severely expedite the building of all the other things that you've got planned for at the East Valley Clinic, and that'll also save you some money because it won't be $2022, $2023, it'll be $2018, $2019. So thank you very much.
Welcome.
Hi, I'm Penny Blake, I think as you both know me, and I am the author of the report that we have been discussing for the Juvenile Justice Commission under our inspection of the rake, which is something that as a state mandated committee we are required to do. And we want, again, to let you know how much we've appreciated the support of this committee in helping us, you know, to fulfill these duties and receiving our reports and addressing the issues in the reports. As to this particular report, there are some issues still outstanding, and what we have done is we have already contacted the new manager out at the rake, Ms. Thomas Washburn, and we will be meeting with her. We already have an appointment to meet with her to discuss especially the policies and procedures manual, which quite frankly, if you've read our old reports, is something we've been asking for some period of time. There should have been a policies and procedures manual, whether or not the rake was licensed. But so we will be following up with her on that. We will be following up with her on the issues of mental health services out there because of the lack of space, the difficulties in providing the mental health services there. So those are all conversations that we do intend to have with her. We've also asked this committee in the past to please sort of keep us informed of what's happening with the location of the rake, and because where that is and what we need to inspect and what we recommend to you, obviously, is going to be very much based on where, in fact, the rake is located. And the JJC's position has been that co-location of services is really the best practice. So thank you very much.
Thank you. Welcome.
Hi, yes, Catherine Campbell. I'm here to say that I appreciate hearing what's happening, what we're doing with our children. Of the 10% that are recognized as being abused and that they need service. And I understand that 10%, how we deal with them is very important. But I'm going to just play the Lorax right now and say I am here to speak for the 85% of the children who are unsubstantiated, who even when there are given names of where to be placed away from an abuser, they are not placed anywhere except with the abuser. And our county has to recognize that right now our children are being forced to live with their abuser about 85% of the time, based on the records, the numbers from Lucille Packard and from the research that we know that if you report abuse that is being done within your family, you have an 85% chance of losing custody to the abuser. And that is something that needs to change and just continue to be recognized. And I do appreciate the comments, Supervisor Chavez, as that we are moving forward. And I appreciate Francesca coming in and doing the work that she's doing. But I never want us to lose sight that we are dismissing abuse and that 85% of children are living with abuse. ACE scores are going up, suicide's going up. I know there was one in Mountain View just this week of a 16-year-old, and I don't know the background on that. But I do know that we are dealing with a problem, and if we're not going to face it, the task force, I appreciate that has been put together for child sexual abuse, but if we're not going to look at the 85%, the task force is not going to succeed. Thank you.
Thank you for all those speakers. Francesca, is there anything else that you or Dave or Steve, anybody wants to add?
No, I'll be attending the meeting with JJC and Cheryl with regard to the rake, and I will see whether or not we can release that policy and program statement draft format to them.
And was there a particular reason we couldn't? Was that something?
I don't know.
Oh, okay, so we got to just figure out.
I don't know, which is why I said I'll research it. I'm not sure why we didn't. I'm not sure.
Your
I'll
shop should
research
take a look at that too. See, because it seems like an odd thing not to be able to share. So, Dave, do you have anything to add? Okay, thank you. Thank you very much for that information. Okay, so we're going to move on to item 5. This is our dually involved youth initiative to be followed by our neighborhood safety unit. Thank you. Welcome.
My name's Alex Villa. I'm a probation division manager from the probation department for the dually involved youth unit.
Good afternoon. I'm Jonathan Weinberg. I'm a program manager with Department of Family and Children's Services over the dually involved youth unit.
Hi, good afternoon. I'm Dan Little. I'm the assistant director at DFCS. I know that Alex and Jonathan have a presentation to do, so I'm just going to do a really quick opening statement. The DIY program continues to seek very robust, passionate participation at our monthly steering committee. You can see the passion throughout the participants in the work that we do, and specifically with this population. And I think you see that reflected within the unit itself, that when we have an opportunity to meet with the frontline staff, you can see their dedication to this population, these youth, and ensuring their success. I know that I can say that with DFCS probation and behavioral health, that we're all three committed to continued collaboration and making sure that we see successful outcomes for these dually involved youth. So with that, I'll turn it over to Alex and Jonathan.
Yep. Thank you. So what we wanted to do is set a little background for the committee. And back in 2014, the collaboration between probation, the Department of Family and Children's Services, and Behavioral Health Services began with the goal of improving outcomes for dually involved youth through care coordination and collaboration of professional and natural supports for youth and families. Now, there are really 5 main pillars of the DIY unit, and the first one I'm going to mention is specialized service and supports. And an example of that is the expert cultural consultancy program that is being developed currently. My understanding is they're in the final phases of securing the consultants and contracting with them. That process should be complete by October. The second pillar is the technical assistance that's being provided through the Robert F. Kennedy National Resource Center for Juvenile Justice. They continue to support the unit related to practice and policy development, specifically to the dually involved youth population. Third, we have the dedicated and specialized staff that conduct all 241.1 assessments for the county, and all of those assessments require a joint recommendation. Applied survey research helped us for this report to initiate the programmatic and service evaluation for this 2016-2017 report. And then lastly, we have interagency trainings. The new and existing partners, these trainings occur with new and existing partners for cross-pollination of the DIY framework and practice. So what are some of these results? For this evaluation, ASR collaborated significantly with the probation department's research and development team, and specifically they wanted to highlight several outcomes or results that they wanted to highlight. There's 12 boxes here. I'm not going to go through all of these boxes, but I did want to highlight just a few, specifically 6. The DIY population within the county is 63% Latino or Latina, 70% male. The average age is 15 and a half years old. 93% at intake were using at least one substance. 8 youth out of the population that was evaluated lived at home. And 8 youth were confirmed or suspected of being victims of commercial sexual exploitation. Now, there are other outcomes and other highlighted results, but those were the ones that I just wanted to specifically highlight for you. So moving on, the probation department conducts a juvenile assessment and intervention system assessment for the youth. And what's important to notice on this slide is that there were 14 high and 11 moderate risk to recidivate youth, with 3 being low risk to recidivate. And those risk levels actually equate to, or we get assistance through the tool to supervise the youth through supervision strategies. Out of the youth that received a JACE assessment, 9 were selective intervention, 9 were casework control, and 3 were environmental structure. What's important to note about that is the rigor that's attached to the supervision strategy is a little bit different for each one of those strategies. Selective intervention being the most associated with an isolated event, casework control being related to a chronic instability within the youth's life, and then environmental structure is related to social, intellectual, and vocational skills deficiencies. This next slide highlights the benefit of the unit. It demonstrates the incremental changes that are being experienced by the youth that are within the unit. So what this slide relays is that youth, when they are surveyed coming into the unit, have higher levels of arrests and higher levels of sustained petitions. But after 6 months of being in the unit, we see a reduction by nearly of half. And so we can see small incremental changes occurring within the youth that are in the unit, and the staff working closely with them and with all of our collaborations occurring with our partners. In the winter of 2017, a youth satisfaction survey was initiated, and the overall satisfaction scores were above moderate on a scale of 1 to 6, 6 being great. The youth satisfaction with social workers and youth advocates was a 4.4, probation officers 4.3, service support received 4.2, and case service predictability was 3.9. So in every area, it was either moderate or above, which is very encouraging for the work that we're doing. So what are the youth saying? Very quick quotes, very helpful, supportive, they feel connected, and they really are benefiting from the pro-social activities aspect of the work that we do within the unit. So what are some of the findings? In summary, we're seeing increases of youth living at home. We're seeing increases of utilization of pro-social activities. We're seeing increases in school enrollment. And we're seeing decreases, on a positive note, decreases in the number of youth using substances and the number of the severity of incidents while the youth are within the unit and receiving services and supports through the unit. When we compare 2015-16 fiscal year with 2016-17 fiscal year, we see a 21% increase of youth deemed high risk. We see a reduction of 12% in the confirmed or suspected CSEC victims. We see a 1.2 decrease in the average year or age at intake, and we see an increase of 16% in male dually involved youth that we're servicing. Some of the recommendations that Applied Survey Research proposed were emphasizing and providing substance use treatment services, continuation of the child and adolescent needs and strengths tool through behavioral health services, the sharing of data related to the CANs, transparency with youth families regarding their case, supports, and services, addressing long-term strategies to alleviate gang involvement and association, and to continue the current gang intervention services addressing gang involvement and association. So lastly, next steps. To summarize, basically, the next steps include continued identification of key indicators to measure the success and the outcomes that we're experiencing and the youth are experiencing, continued implementation of best practices related to data collection, evaluation, and reporting, continued refinement of best practices and collaboration for our interagency service delivery, and continued persistence in working collaboratively with partners for effective evaluation and outcomes of the youth and families served. And for this report, those highlight the key areas that were highlighted within the report, and we're welcome for any questions you might have.
So I have two kind of big questions. And Chief Garnett, I can only see your glasses, but I know you're here, so don't try to hide from me. No, I'm kidding. And so this might be a question really for Bob and Chief Garnett to give us feedback on. And that is that I think this is a very important program, and in some ways it's kind of an important experiment, if I were to just say it the way I think it is. And my question for both of you is, how quickly are we learning from this experience, because it's relatively new, and how quickly are those learnings opportunities, do you think, to either scale this up and or for the learnings from this process to help us understand more about how we need to change the system?
Is it on? Oh. Hello, Laura Garnett, Chief Probation Officer. So, yeah, I mean, it's kind of a thesis, not a question. So certainly we can get back with more information. But, I mean, I think we see, I know we're still calling it the Dually Involved Youth Program. I think we need to get away from that and just say it's just how we treat dually involved youth, period, because they're not just in the unit. But I think we're seeing like the kind of ripple effects, and Bob, feel free to jump in. You know, when there's been issues at the rake, we're doing some cross-training, we're communicating about those kinds of things. The work that we're doing with the kids of adult probationers have all spun off of this. Some of the other primary prevention work that we're looking at with community-based probation officers includes some of these efforts. So it's kind of, I know it just sounds kind of simple, but it really isn't. Kind of the degree that our departments, including behavioral health, are integrated. It's just in a different way from the line on up. Not fully integrated by any means, but I think kind of complex issues that are coming before us we're able to tease through them much more rapidly. So that's at least one thing. And otherwise, I mean, it's a huge change in policy and practice. And I think that has filtered kind of up and down the way people behave in especially probation and child welfare. I think there's a completely different understanding and behavior that's palatably different across the board.
And I would just add is, you know, I think the outcome piece of this, that's work that's going to have to take some time to go through. But the anecdote is, I think just what we're saying is, it's easy for us to get together and say, hey, we've got this great idea, this totally makes sense, and then just go do it. And staff are kind of like, what is this? You know, it just doesn't feel right. And, you know, there was some growing pains initially, some discomfort. And then, you know, more and more I've seen just even walking through where the units are located. I mean, the response is just amazing. I mean, the staff are just like, you know, regardless of even the outcome, which I think we're hopeful we get some good things, it's like, this is so great. It's like I didn't understand what a social worker did, or I didn't understand what a probation officer did. Just the simple thing of breaking down the barriers and the silos has had an immense impact, and the response from staff has just been overwhelming. I mean, it's shocked me when I was just getting, I mean, people were running, you know, after me saying, oh, I want to share with you, you know, what this experience I had with this and that. I mean, we just don't get that kind of response. And I think the fact that really shows the barriers that were in the system and such. So, you know, the anecdote is this is pretty amazing, and the staff response is really, really strong. And we hope the outcomes, you know, parallel that.
You know, I think, let me just share a concern that I have, and then, I mean, just because I like the idea of us trying new things. And I think, Laura, the point you raised about having a whole new way of looking at how we interact with children in any situation, but this situation being where we have a really high risk, you know, and I want to be PC about all this, but these are kids that we are wrapping our arms around and really, really getting deep into their families and really trying to work with them. And part of the reason I'm pressing on what we're learning is that it's also a really expensive program. And here's how I've been thinking about just our future. I remain nervous every time every time my phone vibrates and CNN says, oh my God, this has happened. Or the Washington Post says, oh my God, this is what's happening next. And I'm mindful that part of the reason I was so anxious, and I know Dave was, to put the half-cent sales tax on the ballot is that I'm nervous about us having a dearth of resources and being mid-process in some of our learnings with some of these more expensive programs. And so I guess what I'm wanting to better understand is when the things that we're learning to do and frankly not to do, because I think sometimes we have to be able to just say, we tried this, it didn't work, and that's okay. Like, I don't want to, like, this is, to me, the more we can get out of that poking at each other, the better we're going to be for serving the community. But I am really anxious about those kinds of learnings that really should be moving through our organizations that faster, that may not just be about this particular practice, but I think the point you raised about what happens if we approach problems in X way, and we've learned that by working with this unit of dually involved youth, that here's what we've learned from that, and by the way, what that means concretely for program in a whole bunch of other areas is X, Y, and Z, and these are things we should be trying. That's really what I want to understand, recognizing your points are not lost on me, that these take years to sometimes understand the full and total impact, but there are some issues that we need to be able to glean faster as we see them coming up, because they may impact, I don't even, whether it's policy, practice, procedure, even the way we identify who's at risk versus who isn't at risk, right? And probably most importantly, and I know, Laura, this is something that you and I have talked about, and I know this is like right in the center of your thinking and in the way you want to approach the work, is what we're learning that gives us an opportunity to look at prevention in a much more aggressive way. And so I don't want an off-agenda report. I'm sure you're all okay, good. But I do want to better understand from the two of you what we think those things are. And even if that's a discussion at another meeting where we have a little more of an open discussion, that as we look at, and it may not just be the dually involved youth program that we want to take a deeper dive at. There's some other things that we're trying that are new too, but we do really need to understand, how do we take those things through the organization? How do we share what we've learned? How do we share what we've learned we shouldn't be doing? How quickly can we do that so that the program demonstrates its value beyond anecdote? That's really what I'm looking for.
Great. I think we can do that. Two quick thoughts. I think this unit and actually the initiative itself ends up kind of being a proxy for problem solving on a much bigger level. So, I mean, there's big problems. What do you do with an 11-year-old who drives 75 miles an hour through a red light in downtown San Jose? I mean, if none of us have that answer, and it, it matters to county council, it matters to the citizens of San Jose, it matters to all of us. And this is a proxy to really look at what do you do with that. So that kind of spun in, some of these cases directly affected some of the legislation that's currently pending in the state. So I do think this serves as, and county council has continued to look at what do we do with regional center clients that are charged with a criminal offense, knowing that they can't be brought to competency. I mean, that's like, I don't think that's being looked at in the country except for in our jurisdiction. Mm-hmm. It wouldn't be looked at in our jurisdiction if we weren't doing this work. So I just want to say, I definitely think it is very expensive, and that isn't lost on anyone, and it does feel like it's a finite group of youth, and it is a finite group of youth who get, kind of the Cadillac service. But there are these other ripple effects. And then the second thing, and I can't use his name, although I will tell you later because the contract is pending, but we have hired a gentleman from Massachusetts who's an expert in disproportionate minority contact, and like one of the best scores we could have gotten with a contract through the courts. So he's starting like October 1st, and he'll be, I don't know if you remember Neha Desai, who was our kind of project coordinator. He's a consultant, so it's a contract, not a coded position. He's pretty much at the same level she is as far as his breadth of knowledge, if not more so. So his whole job is going to be doing exactly what you just said, which is taking what we already know. I mean, we could sit and talk about this, but it doesn't really do anybody any good if we can't put it, in writing and actually say this is what we're doing and watch it happen. Like, that's what he's going to do. So.
And that's really helpful. I think it matters so much, especially, I just think that I've been really thinking a lot about sustainability lately and just about how big the county's gotten, and at some point we're going to not be this big, and we're kind of throwing staff at problems, and I'm more nervous that, I don't mean this in a bad way, I think there's a lot of problems we need to do this with, but really understanding what we're learning, because at some point we're going to be scaling back. And when we do that, doing it in a way that is not just least harmful, but really does grow back in a really healthy way. And I think about, every year my husband cuts the bushes in front of our house, our rose bushes, and I'm always terrified when I come home and I think he's killed like half of them. I'm like, oh my God, we'll never see them again. And we have this same discussion every year. And he always explains to me, we're cutting back to grow in a certain way. And I want to make sure that we have the kind of data that allows us to do that. That's partly why I'm pressing on this. And frankly, I think the other thing that you've been talking about is we think about prevention and being really, really aggressive about accumulating prevention dollars. We have them spread out all over the county super ineffectively. We need to bind them together and start thinking about place-based strategies, I think, is where we're going to have to start, just because I think that's going to be the easiest to evaluate, but really being able to marry what you're learning with that kind of longer-term thinking. Dana Bunnett. I apologize. Come on up.
I'm Dana Bunnett, Kissen Common. I've been involved with the DIY work from the very beginning, and I think it's one of the most important things and one of the most potentially transforming things we could be doing in the county. I've always been of the belief that our kids that are coming into these systems, which are the systems we prefer them not to be in, but kids that are struggling come in through the mental health system, the child welfare system, or the juvenile justice system. And I think they really, in a lot of different ways, if you did a Venn diagram, there would be a lot of overlap in that. And I've held ed rights for a couple of kids. One young woman, 15, in the probation system with a little baby. One day, her probation officer came over for an EMP visit and found her had marks on her face. And this is a few years ago. And so the social worker came, and they removed the baby, but they didn't remove her from the family situation. And that's because the social worker didn't realize that even though she was on probation, she could be included in this work. I don't think that would happen now. I had another young man who was up at the ranch, family all over the place, really a child welfare person. And I, as his advocate, started calling social workers. Who's the social worker? He's got to come to this MTT for him to leave. And I had to pull the people together to talk about what was going to happen next. And at one point I said, well, what school is he going to go to? Because it's really important that we get him to a school where he's going to stick. And the social, I can't remember whether this probation officer or social worker turned to me and said, well, that's the least of my worries right now. And it's this, I think what has begun to transform in the system is this more holistic approach to the young person. And the unit's one thing, and that's really critical in some cases to some kids. But first of all, I want to point out the unit served 40 people in the first 6 months of the last fiscal year, so it's already increased in the number of kids that are being served. But it is transforming, and the people that started with this, Patricia Gardner, Hector Sanchez Flores, other important community people are there to talk about prevention. So thank you.
Thanks, Dana. Thank you all. You're good? All right.
Say I appreciate your line of inquiry, and it's sort of the old adage, when you start looking at detail, are we even asking the right questions? And when I listen to even to some of the hypothetical questions without being adversarial about it, a lot of people are looking at, what do I do? Dana was just talking about that's right in front of me right now, as opposed to how do we prevent getting to this point? How did we get here in the first place? As far as I'm concerned, we have a 14-year-old in the county incarcerated anywhere here for a year. The entire county is a failure. That's a failure. We view it as, what are we going to do with this 14-year-old that's in jail? The question we should be asking ourselves is, how the hell did we get to this point where we're incarcerating 14-year-olds for a year? That's what duly involved should be about. It should be the inquiry about, what do we need to do downstream so that happens. I know we're doing a lot. I know probably in the next report we're going to hear about a lot of things that we're doing early on, early prevention and intervention, but I just want to say I appreciate you at least raising the idea of recalibrating the fundamentals and the very questions that we should be asking.
Thank you. Well, thank you, everybody, for your good work, and this is exciting and more to do, right? Always. So thank you, everyone.
Great. Thank you.
So now we're going to go to the Neighborhood Safety Unit.
Good morning, or good afternoon. Mariel Caballero, Deputy Director, Probation Administration.
Good afternoon. My name is Charmaine Moran. I'm the Program Manager for the Neighborhood Safety Unit. So we do not have a formal PowerPoint today to present, but what I would like to do is walk through the report with you and sort of highlight some elements, some programmatic elements, and other performances of the NSU this fiscal year, and then we're happy to take questions at the end.
Let me just say through the chair, I know Supervisor Chavez is, often inquiring as to how much detail I need because she knows of our special interest in this particular program. But I agree, we've looked everything over and always have specific questions, but you can stick with the captions and the highlights just so everybody else in the audience understands the context, I think. And I don't have a lot of questions today, but just a couple inquiries. Thank you.
Sure. So I'll go ahead and walk through the elements, and I think in the future we will come with a few slides to summarize our report. So first, what I'd like to do is sort of walk through some performance and programmatic highlights of the report as this kind of concludes the fiscal year 17-18 of the Neighborhood Safety Unit. I'd also like to address towards the end the Youth Fellowship Program and some of our interesting findings around supporting project-based learning and individualized learning in the communities that we are working in. So first, overall, you'll see that the initial table indicates that we highly overperformed in many of our performance categories. Now, as you may be familiar with my reports, I'm kind of skeptical of all numbers in general, and I think that overperformance could be a result of, one, not defining our performance targets accurately, or two, we just did better than what we thought we could do. And so I think that moving forward, and just so you know too, we have increased our performance metrics by 10% each year since we've been operating. So since fiscal year 16, in fiscal year 17, we overperformed. We increased our performance metrics so that our service providers would provide additional 10% of services to youth and families. And then in fiscal year 17, we increased those again. So overall, we've increased our performance by 20% in 2.5 program years. And yet we're still overperforming. So I think what this should require some conversation about what are some accurate performance targets, because I think it's nice to exceed performance, but it's also nice to set those targets accurately. So I think that we'll go back to the community and really open up that conversation as to what should we be aiming for. So I just wanted to point that out to you.
May I just add, I think the other question for them would be why? Like, why are we hitting them? Is it new? Is it exciting? Is it we're making it easier? What's that? Because in some ways, you don't want to totally knock yourself out of the box because you were effective,
Right. Yeah, I do think that there's sort of the snowball effect, right?
Yeah.
As you work in community and you provide opportunities for neighbors and residents to get to know each other, they become more trustworthy of that service or of that space. And so we are seeing that across the board, and I think there's some interesting conversation
Well,
around
the
that.
other question I'd be curious about is the norm changing in terms of engagement?
Right. And I could probably definitively say that that is changing in the communities that we're working in.
Right?
And I think that the question now is, well, where do we go from here? And so that's really what our performance should be, telling the story. And I think that these performance targets were set at the beginning of NSU, so kind of as this program has evolved and developed. And I think now is a good time to really look at what should we be aiming for, since we have a lot of this program work under our belt for the past 2 years. So I wanted to highlight that. And then in addition, just so you know that we are increasing our performance targets again for fiscal year 18-19, so that will happen. And I think we're doing across the board at 15%. So we are already in fiscal year 18-19, and so we're really trying to open up that conversation, but yet keep the ball rolling. So another thing I wanted to highlight in the report is that for zip code 95122, table 1 sort of summarizes the neighborhood action goals that initially the Valley Palms leaders had defined. We do expect these neighborhood action goals to change, as one of them has been accomplished and 2 of them are still in process. But I say that they'll be changed because our relationship with our primary community-based partner, Somos Mayfair, is working with the Valley Palms community on developing a participatory budgeting process whereby they will kind of reevaluate where the funds that we provide them to do pro-social activities, to do community engagement, to really change the landscape of their community. Where should those dollars be focused and how can they stretch those dollars? So this is an interesting development of the Valley Palms leadership group, and we expect some changes to this table. It probably will get longer, I'm assuming, and more detailed, hopefully. So I just wanted to point that out to the committee. So the Somos Mayfair initiative is progressing. We have contracted with Somos Mayfair to include a pilot promotora program, which implements a community leadership, sort of grassroots community organizing methodology. Essentially what it does is it teaches residents how to facilitate conversations around race, equity, access to educational resources, how to accomplish their vision of safety and other goals that they would like to accomplish in their neighborhood. And so those conversations are happening, and they're happening on a bi-monthly basis. Any of you are welcome to go if you'd like. They're exciting conversations, and we look forward to those sort of helping the Valley Palms community evolve to sort of become more structured. So that work plan has been in place for about 6 months, and I'm more than willing to provide it to you if you'd like to see in more detail what that process looks like. So to highlight some activity in zip code 95020, which is primarily focusing around the San Isidro East Gilroy neighborhood. That neighborhood, again, has historically suffered from mostly drug trafficking, related crimes. Human trafficking has been reported in that park, and other sort of drug-related crimes. It's not in the report, but I am happy to report to the committee that there has been, I believe, 0 calls to service during this summer at the San Isidro Park, which is a phenomenal accomplishment in comparison to recent years. And so that park has really, in collaboration with the Public Health Department and the NSU and the residents in the city of Gilroy, has really become a safe place for residents and neighborhoods. There are still some illegal and illicit activities that happen, but we haven't seen the level that we've seen in the past decades. And so the Gilroy Police Department has commented about that during the South County Youth Task Force Policy Team meeting as well. So that's very exciting news, and that's why I say I think that what we're doing is kind of working, because people are going to the park and they're participating in services, and they're having ideas, and they're expressing them with their neighbors. So I wanted to highlight that. I also want to highlight that the performance targets in the initial table are probably underreported, because at the time we aggregated this data, we did not have the fourth quarter report data from the South County Youth Task Force. So again, this table does not include that number, which would have included the Party in the Park numbers, which would have significantly increased the percentage. And so recalibrating those performance metrics is going to be a key goal of ours this fiscal year. So then I'd like to just highlight our partnership with the Gilroy Unified School District. What we do know is that in the San Isidro area, Elliott Elementary serves almost most of those elementary school-age children. Glenview Elementary also serves a percentage. But what I highlighted in the report was the decrease in office referrals at 48%. So we're seeing that our support in these schools in allowing extracurricular activities such as soccer, mindfulness training for the teachers and for the students, and just all the menu of pro-social activities that NSU is funding throughout the community seems to be having an impact. We did not see this level of decrease in the year prior, although we weren't tracking it as we are now. So I think that this table is going to be important to include in ongoing reports, and I expect to include it moving forward. But it's a positive sign. With regards to the NSU Fellowship Program, we were successful in serving our target number between 20 and 30 youth. So we served 26 unduplicated youth residing in these neighborhoods. I think we served about 16 in East Gilroy and 11, I believe, in East San Jose. You'll notice that in the attachment, we speak to some of the initial outcomes that we were measuring. Again, this is the first year of programming for the NSU Fellowship Program, so we expect to have a lot of lessons learned. And I think that we're very open to what those might be moving forward. But overall, we accomplished what we set out to accomplish, which was to allow youth from these communities to have access to a really robust menu of leadership development activities, access to people who can mentor them, and different types of curriculum that they otherwise wouldn't have in a school setting. And so these young fellows had accomplished so much during their year of service. Many of them participated in civic engagement projects that we didn't even ask them to do. And so the report highlights some of that, but what I want to also report out is that as we do a pre and a post assessment using the Joven Noble assessment tool, and what our researchers noticed that one of the items in that assessment looks at how much do youth feel that they belong to their ethnic group? Meaning, what does that mean to them? How do they feel they belong? And they found that that had a statistically significant increase, although the sample size is really small, from 2.3 to 3.3. So in the report, our evaluators highlighted that that was something that was a positive outcome of this program. Again, we didn't do the Joven Noble curriculum kind of as a standalone. It was really integrated into the civic engagement and into the leadership work of the fellowship program.
So I would also just like to highlight a couple of intangibles that Charmaine didn't highlight, because it's really how we see neighborhoods and community changing. In Valley Palms, we're seeing more men participate in the Valley Palms Unidas community leadership group. And what that means for us is that fathers are more connected to their families. They're interested in what's happening in their community. And
So let me just sort of analogize that to what we do in our high schools. And the point of that is because an astute liaison has intel as to what's been happening in the surrounding neighborhood, where retaliation and when retaliation is likely, and then has the ability through information on the streets to figure out if that's going to land there. And I don't want to just push it off to some other neighborhood, but I do think it's a pretty successful model. When it's quiet for a long period of time in our high schools, it's not an accident. It's because people are through law enforcement, liaisons, and a lot of advanced work is what I would call it, intelligence work, are getting just ahead of the curve enough to start heading things off, and even to work with the in this case, the neighbors who aren't involved with that, to let them know what they're, that there's concerns, so that people don't get in the way of all that. So I think when that happens, there's a tendency for those who are going, when there's that kind of presence, and it's clear that that kind of intelligence is being gathered and that it's for the purpose of keeping that site, that area safe, it does have a deterrent effect on organized crime, who have other alternatives as to where and how and what to do their business. Again, I don't want to push it off to someone else's neighborhood, but the fact of the matter is we're trying to make this one safe first, and then as I said at the beginning, as I acknowledged at the beginning, we made a decision early on here. We're not going to be able to rid the whole county or every neighborhood in the biggest city in the county of gang activity here like they try to do in Richmond. We're going to have to take one area and figure out what's successful there. And I'm just suggesting that that would be a conversation to have with them. And I think speak for my colleague, more than happy to help if need be to facilitate that. I know you have your own lines of communication with the chief over in San Jose and people in power over there to try to facilitate that kind of thing. But again, I'm just suggesting that as an additional step, to demonstrate our credibility to that community, that we're not just standing with you, we're going to continue to ramp up resources, to counter what's going on an organized level. Thank you. And please feel free to respond through the chair.
So just to respond to the last point, I think one of the great things that Charmaine's team has been doing is really identifying when those communications break down and try to develop or reinvigorate existing protocols for how we share information, how we find out about incidences, how we ensure that staff are safe on site, and what services we then roll out to families and youth, whether it's the program with the hospital about the intervention programs, that Supervisor Chavez has championed, and what those services look like to not only the victims, but also the families who are impacted by the trauma of witnessing something. So we're definitely working with SJPD, Mayor's Gang Prevention Task Force interventionists on strengthening that with the DA's office and everybody who needs to be part of that team. So we're having those conversations. We can bring that back as a recommendation of some sort of liaison type position with the city police department.
And
So we'll definitely be bringing that up.
And I understand it's an FTE I'm talking about here, or more than one, 1.5 or something. I mean, I get it that there's a fiscal impact here, and it's not just a magic wand about asking somebody for help. So, but that's all the more reason that we would want to know if that's a possibility, so we can try to create that fiscal reality. Thank you.
Reality. The other thing I would just follow up on that is that, again, as we're having the discussions relative to prevention with DV and with the public health department and really with you, I mean, one of the questions we have to ask ourselves is, how do we make investments, and how are those investments made in partnership with the city of San Jose? So there's a level of investment from them. And Gilroy is a little bit of a harder place, I know, for different reasons. But I think this is a really good opportunity to have a conversation with them about future investments, because I agree with you, Dave. I think that they're really they're understaffed, period. And as we think about the new partnership with probation, I mean, we should think about whether or not there are opportunities to really create a different kind of presence in a particular neighborhood. In part, I think, to go back to the discussion we were having earlier, is I think we really need to understand how to test new models and how long it actually takes. The one thing I don't think we fully learned from, God, I'm going to totally date myself, but from Project Crackdown and...
They're still doing the same thing.
Yeah. But the thing I look at some of the places where we've used SNI and other kind of programs, and Weed and Seed, that's what I was thinking about. Project Crackdown, Weed and Seed, oh my God, we're 100. Weed and Seed and Project Crackdown and the Strong Neighborhoods Initiative, that in some instances, it's really interesting because you've seen the impact of those programs last years after we've removed staff. And in other places, we've seen it not quite so much. And so I just think it's something that is worth us, from a next steps perspective, really giving some thought to the kind of investment strategy, meaning that we would be taking a look with the city of San Jose and saying, what do you think about a 3-year partnership that then allows us to do another check-in? And I have some evidence that I recognize that some of it's where you have income differences and what we call gentrification, but in some of our neighborhoods that wasn't the case, and SNI is probably a really good example worth us thinking about. The other thing is, with the chief, we're doing our next quarterly meeting with the PD, the San Jose PD, and we're going to talk about behavioral health, but maybe we can catch them at the end to have a a little discussion since we're going to be making some recommendations on investments. And we can talk to the mayor about that too.
And I just wanted to say last night, several of the national night outs that occurred, you could see a lot of the same kind of work that you're doing in the NSU, over on the city of San Jose side. And they're working with the county, and they're working with schooling services where they have it. And it's obviously very productive work, and I know this is very productive work, and I should say, folks continuously talk about how they're continuing to essentially just recalibrate and redefine Weed and Seed, Project Crackdown. Some of those were federally funded programs that we didn't have local money for, strong neighborhoods. So it is still in play. I just said that because joking about dating yourself, the fact of the matter is I think that state of the art is still the state of the art. It's just a question of resources and where we can deploy it. And anyway, thank you.
Thank you for your good work. We really appreciate it, and we look forward to seeing what your new goals are. I was going to send Laura a quick note that said, don't raise your hand yet to get more homework, but we'll look forward to your research and what you learned. Thank you both. So with that, I did get one written comment I just wanted to read into the record from Monique Gonzalez. She's a student. She says that this should be a high priority in the county funding-wise, need better structure plan to make sure 100% of kids are safe, and there should be more consequences for abusers. So we're going to move to our Social Services Agency Director.
Okay, so I just wanted to mention a couple things. Our summer portion of our Intern and Earn program wrapped up on Friday, and I just wanted to let folks know we'll be celebrating that on Monday at the ceremonial presentation, so there'll be acknowledgement of the program. We're all a little sad because our young adults are now not in our workplace anymore, and we had a great time with them, and they were amazing. I think we had a great success this year. Foster Care, CalFresh both hit their targets of recruitment that we had set out at a 93% completion rate in foster care, 80% in the CalFresh, so we're going to learn some things there. First time working with them. So CalWorks, we're a little bit below our target, but we always have a huge target because we have a big pot of money to fund there. But definitely a great success. Served 482 kids, young adults this summer, so that was definitely exciting. A little under half were employed here at the county. 40% were at our CBOs, and around 13% were out in the community, local employers, private employers, things like that. So definitely looking forward to Monday and celebrating the program. The other thing I just wanted to mention is in the state budget, home visiting proposal was passed under the CalWorks program this upcoming year. It's a half-year program. It'll be a little under $30 million. Next year it'll be a little over $50 million. And the state just released their all-county letter on the process to apply for that. So just wanted to sunshine that. We will be putting together a proposal. There's no match requirement, and that's the good news with it. We'll be partnering with public health, and again, this is another kind of small prevention program, but has us thinking in the prevention light. And that's it.
Thank you very much. Ignacio?
Thank you. I just have one item, which is to briefly mention August is Child Support Awareness Month, and we have a multi-media campaign going on right now to educate the community around our services, who we are and what we do, how to take advantage of the services, how to make payments, and how to get in contact with us. We have a resource table outside right in the breezeway here at 70 West Heading. We have videos that are showing on television. We have a large radio campaign through KFOG, KSAN, KGO, and KMBR as well. And it's something that we're doing on a regional basis this year with other Bay Area local child support agencies. So I also wanted to mention that we're scheduled on Monday to receive a proclamation from the board proclaiming August Child Support Awareness Month. So we were at the San Jose Giants game last night, had a resource table there. To be able to help folks and answer questions. So there's a lot going on in terms of outreach for our services, and we're very happy and supportive of the fact that August is Child Support Awareness Month.
That's very good. Thank you very much. We don't have any other reports, so we're going to adjourn to our next regular meeting on Wednesday, September the 12th, 2018 at 2 o'clock. Thank you, everyone. Thanks, Dave. Mr. David.